can we reform the health system without having all our processes and services digitalized? And there is a program called LIFE, the acronym for Living in Full Health, and this is an initiative that the partnership is being launched tomorrow at the end of the conference, where persons in the diaspora will be joining a group of researchers at the University of the West Indies, the Fox Chase Cancer Center in Philadelphia, Pennsylvania, and the Hope Center in California. And basically what it is, they have persons they're going to be following for the next 5 years, persons with non-communicable diseases and cancer, and our role will be to work with them virtually. So we'll stay in New York and we'll have patients here in Jamaica, helping them to manage their condition. The areas for opportunities, again, there's a lot of areas that we would like to let the ministry know. So I might not be able to share all of them here, but you have to invite us. Invite us to your meetings, invite us to your boards. We want to be there to say, people are sitting out there cannot share everything today. But we want, after this, we want to have regular meetings. And so some of them quickly, to digitalize all processes, to facilitate and ensure efficiency, productivity. We got to think about maybe better patient outcomes and workforce satisfaction. We want to be engaged. I'm not going to go there again. Develop a database of Jamaicans in the diaspora with expertise in various subject matter. How are you going to know if we don't have that? Lots of experts out there. You know this, we're little and we're Talawa, and we're all over the world. I'm only speaking for the Northeast, but it's global. We want to be involved in the vaccination and nutrition services in school. We want to work with the education sector. Who is out there doing that for them? The diaspora can help. We want a better infrastructure for connectivity, for sustaining telehealth. Here we are recommending telehealth, but can the people be connected? You know, so often we don't have Wi-Fi and all that kind of stuff. So that must be considered. We want the medical missions to be on a database for cross-referencing, collaboration, and partnership. Too often, one mission around the corner here, one there. We don't know who's on board. We want to know who has the neurologist, who has the cardiologist. Referrals. Not sure, I can't talk for it if it's being done now. Mission ends, what happens to those patients? We want continuum of care. Often I've personally worked on missions. Patients will say, I've waited for you since last year. We don't want that. We want to be able to say, patient to say, I saw Dr. Brown every 3 months while you were away. Mental health professionals must be on mission teams. I think that should be a requirement. They must be on the team. Yes, nurses and physicians are trained to do psychosocial assessments, and we do that, but when you have, that's their expertise. We want to conduct medical missions in the non-traditional venues, like we did in South Lamar, we did the hospital. How about now that we have adoptive clinics, we set up some of these missions in the clinics. The persons who adopt the clinic do their mission there. We can go to the infirmaries, the jails, and I have to tell you about one mission that's so non-traditional. Jaja Foundation, which does a mission called Healing in the Dance Hall. Uptown Monday at Sovereign Plaza, we actually do a mission there, leave our hotels after midnight, and we work with people there until 4 a.m. in the morning. Okay, so that's another way to transform the system. Streamline the process for credentialing and clearance of equipment and supplies. Streamline the process for credentialing. And last but not least, diaspora to assist with quality insurance improvement and share best practices. I'll close my presentation, Dr. Rule.
Yes, ma'am. Hold on one second.
Right. Okay.
The iPad is blowing up, so I have questions for folks, right?
All right.
So I'm going to ask questions of the panelists, and whoever feels comfortable answering, do that. Then we'll take an audience question, and then we'll engage the panelists that are online virtually from the UK and from Canada.
Okay.
So does that seem to work?
That's fine.
Okay. So one of the questions is, it's a question/comment. There is a concern about alcoholism and substance use in Jamaica. What is being done to address it? That's one question. And the second question is, why does we need a single parish, every parish needs a mental health hospital. Why is there not one? So those really two questions, maybe they're related in terms of the answer. Okay.
So in terms of the alcoholism, so we are moving towards a policy on alcohol use country, and we are in the preliminary stages in terms of putting together that policy. And that policy will cover quite a bit of areas in terms of access, in terms of educating persons, and in terms of how we relate to the manufacturing sector. So this is something that will involve quite a bit of multi-stakeholder engagement so that we can ensure that we're all aware of this and be a part of saying how it is that we go forward with that. In terms of the drug use, we have the National Council of Drug Abuse that have various programs in terms of educating persons and in terms of addressing the issues that arise in terms of management of persons who are in crisis and who have problems. Okay. So we have that program that is very active. I don't have all the details here, but it's something that we can prepare, in terms of send it out in terms of to the diaspora, in terms of the different activities that we have under the National Council of Drug Abuse. In terms of the mental health, the necessity of having a mental health hospital in each parish. Well, the drive now is to move away from institutionalization and to get mental health management within the communities. So there is a drive, and we have been working actively on this in strengthening our community mental health program, but also increasing the knowledge and the capacity of our regular physicians, in addition to our psychiatrists and the other mental health workers, in terms of managing the persons with mental health problems within the local district hospitals, the community hospitals, and the other levels of hospitals. So we are strengthening that capacity as well as the community programs. And our big drive at this time is not in terms necessarily of managing mental illness, but is in focusing on mental wellness. And so we have a lot of programs that are starting from the school level. We have a school mental health literacy program that we're working on in terms of educating the children and the teachers within the schools as to how to manage problems, to identify problems. We have other school initiatives that we're working at. And then we also have our community programs where we have a program that we call PM Plus, program that we're working with PAHO in developing in terms of recruiting the regular person in the communities to be able to address some of the issues that life stresses. As I say, it's about mental wellness, dealing with the life stresses before they become issues of mental illness. So we have those programs that we're actively working on, but the short answer is not focusing on institutionalization, but to build the capacity within the communities and within our local hospitals and our health centers as well to manage mental illness and to promote mental wellness.
Okay, thank you, Dr. McKenzie. Minister, would you like to respond to that?
And I'll just add, as far as what Dr. CMO said, yes, the focus, especially now, we hear of the different drug abuse happening in our schools, and so it is very important to address that. Okay. And we saw coming out of the pandemic quite a number of persons, and we saw the numbers increase. I don't have the total numbers now with me, but the numbers did increase as far as persons reaching out to the hotline, reaching out for help, and we saw the numbers of drug abuse actually increasing. And so it is very important for us to continue the education in our schools with our children, because I think it starts there. And so much effort will be made this year going forward to educate our youngsters about the harmful use of drugs, especially some of the ones that we hear in recent times. Another thing that is on the books right now, going on as I speak, is the legislation on the tobacco. Legislation is going through the parliament now. And so we know that a lot of our youngsters, they misuse tobacco, and we want to prevent that. When you talk about non-communicable diseases, that is a part of the thrust also with the primary health care to, also with the primary health care, and also to make sure that our students are not abusing tobacco. And so with NCDs, you know, and the focus with that, we want to make sure that the youngsters, that they do not start this from a very early age into adulthood.
Okay, thank you. Okay, so I promised that we'll take a question from the audience. One question, because we have two panelists, one in the UK, one in Canada. One question, please. Make it a question. So, Doctor, I see a hand up. Please identify yourself and tell us where you're from.
Hello, good morning. My name is Dr. Desireen Dunn, and I'm a nursing professor, and I live in the Midwest.
Thank you.
And I have been on missions here. So as I'm thinking about the project Code Care that is that you are embarking on right now, I'm thinking about all the missions that have been that have come to Jamaica, and I understand that it's about 200 missions. And from being through this process, I know that the credentialing, through the credentialing process, you can get a lot of information. So I'm wondering if there is a database that is available where you can tap into it to find some surgical nurses, because I'm very sure that there's a lot of them that came down. I myself is one. And so can we go there as well as proceed with whatever it is that you're doing across the United States, Canada, and UK?
Okay, thank you for your question. So only one question. So I think maybe just redefine for us specifically what Project Code Care is, right? So it's a recruitment of surgical nurses and surgical staff, I'm assuming, because of a backlog of surgical cases. So redefined, if I'm not misspeaking. And the question, I guess, is there a database or some information about, from prior medical missions, or any other database that they can look at and say, okay, this is what we need, we know this asset is there, and we reach out to them directly?
Okay, so in terms of Project Code Care, so just want to point out that the project actually have several arms.
Okay.
And one of the first arms is for us to increase our capacity within our facilities with the resources we have in terms of extended hours, weekend hours, in terms of utilizing any operating theaters that are underutilized, just to maximize the amount of surgeries that are being done to reduce the backlog. And then we also have another arm that is procurement of equipment, because some of our operating theaters have been down because of need for reliable anesthetic machines. Operating theater beds are malfunctioning, and so another arm is a procurement of these equipment. We have identified specific theaters that need this push, and so we're working with that. And then we are also, another arm is in terms of ensuring that supplies are in place, because we have, of course, when you have a number of surgeries that are being done, then we run into especially disposable items that may become short, laundry items, you know, to ensure that we have disposable items that will not hold us back. So we're also doing that procurement as another arm. Of course, in thinking about this, we recognize that one of the areas that would be a stop in going through with this process was our ability to have nurses on board. And so we came up with the nursing missions. And initially, our target was that to identify missions that had been done already in each hospital, where it is that relationships were already existing, and to get to those list of nurses. And so we are working on that in terms of seeing the list of nurses that have been associated with some hospitals already, are familiar with the processes and teams there, and we thought it would be easier to get these persons back on board. So we are working on that from the hospital end, but also from in terms of the mission organization unit that is within the ministry. But of course, we have mushroomed outside of that in terms of now trying to get other persons engaged. Because when we look at the problem, while we're addressing backlog now, we have a year in, year out problem in terms of not being able to manage predictably the numbers because of shortages. And we lost over 500 nurses last year. So that is, and you know, even though we recruit back into the system new nurses, the level of experience and knowledge, that takes a little time to build up. So we wanted to see a program that could be continuous, that if we had a cadre of persons that we were able to roster throughout the year, not just in terms of the backlog, but going forward, we thought that this would be helpful. And we thought it was an opportunity for us as a country to re-engage with the nurses that have left. Instead of they've left and we say goodbye, you've gone to greener pastures, we recognize that Jamaicans that go abroad have a yearning to come back and to give service. And many times the opportunities are not so clear, you know, and we thought if we created this continuity of communication, this re-engagement with our nurses that have left, then we could develop a continuous program. And so that's what we're working at. So that's what the project is about. And in short, yes, we are looking at the persons that we have had to try to identify them and make contact with them.
Okay, so let's be fair to the panelists in the UK and Canada. Let's have them share their message. Then I see lots of hands and I'm getting lots of questions, but let's go to the panelists. First, Dr. Upton Allen in Canada, and then Antoinette Brown, who is in New York. Is Dr. Allen online to share his thoughts with us? And if not, we'll then go next to Antoinette Brown. She is the project manager in IT. Good morning, Antoinette. Nice to see you.
Good morning, good morning, good morning.
Good morning. We're in sunny Jamaica on the harbor. It's wonderful here. Wish you were here.
I wish to. Good morning also to the various panelists and the distinguished guests. So my name is Antoinette Brown. I'm located here in the United States. I'm working for a large healthcare system, and one of my job is as a healthcare informatics specialist is to basically implement EMR systems across our local systems. And one of the things that I'm glad to hear that the CMO expressed was Jamaica's process in implementing an EHR system or / an EMR system. And one of the things that I believe is that the Diaspora can be a hand in helping through that process. You know, when I look at the transitions that we have done in the United States from moving from paper to digitization, it's a tedious process. And a part of that process is not just only the infrastructure set in, but one of the things that we have identified here is making sure that we are engaging the workforce itself in that process when we do the transition. We cannot lead a digitization process from a top-down approach. We need to get the nurses involved in that process because they know the process. And additionally to that, then also linking the policies and procedures that go with that workflow process. So one of the things that I've come to realize that the diaspora needs to help in regards to how we prepare our nurses for that process. And the next thing is that how can the diaspora get involved in that process? The second component to that also is the emergent technology that's occurring. A few years ago when we started the process and transition to electronics, things have changed. And COVID itself has also changed that process. One of the things that I like that Claudette brought up was the whole idea of telehealth. During COVID here in the United States, we had to fall back to telehealth process and telemedicine in order to take care of our patients, making sure that they were engaged, making sure that they were a part of that process and their quality of care. And additionally to that, how do we even prevent? Because I'm telling you, once we make that transition, we got to start thinking about the burnout process in regards to our nurses, in regards to our MDs. And some of the emerging technologies that are coming forth now is the utilization of artificial intelligence. We're seeing now the usage of virtual assistants that will help doctors to do their planning. We're also seeing the usage of blockchain basically to help with how we safeguard medical records, also how we go about in searching for records. So I believe there's a component of things that the diaspora can do. There's a component of other things and tapping into the gems that we have in the diaspora. The U.S. also is going through a process where many nurses are leaving the field. How do we get those nurses that are leaving the fields here in the States, abroad, and everywhere else, and get them to come back home and help in the investment process of changing of how we digitize Jamaica in general? Gary, those are my few points. I know that we have just a moment left, and I want to be fair to the other panelists.
Thank you so much. Okay, so we have 4 minutes to the next break, so let's take one question from the audience, and then we'll have Paulette Lewis in the UK who will give her presentation. So one question, please frame it as a question for us. Who's identified? Bishop Peart?
I am Pastor Paul Peart, Bronx, New York, pastor of the New Testament Temple Church of God, and I represent the Church of God of New York. Our church sponsored, adopted the Gordon Town Clinic. Of course, the major ask from us is to make a financial contribution for, upkeep and so forth of that clinic. But a thought came to me concerning that financial management of the funds that can be contributed. If a better way can be invented to make use of it. Take, for instance, can something like an endowment fund, a healthcare endowment fund, be set up so that when funds are given, it is not just spent like that? It can be invested in the booming economy of Jamaica. And then the interest and dividends are then used to cover those expenses, so that you actually then have a permanent source of fund instead of keep on going back to the well. One day the bottom must drop out. That's the question.
Okay, so thank you for that question. I think your question, the response is multi-layered and kind of complex to answer in 2 minutes, right? Because we need to break at 10:28. So let's hold that thought in our head. And if there is one other quick question, we'll take that, we'll listen to the question. That way our panelists can ruminate on what it is and then answer after Paulette Lewis from the UK. It's probably 5 o'clock, I don't know what time it is, 5 hours ahead. Let her give her presentation, then we'll answer that question. So that will give us some thoughts about thinking about the response. A 10-second question, just as a placeholder. 10 seconds?
I'm Lorraine Smith, and I'm one of the co-chairs from the Northeast. I'm a licensed. Counselor. My question real quick. In terms of telehealth, how can we as the diaspora really play a true role in telehealth? I was a part of that mission. I supported the clients, the patients, as well as the providers. And when we went back, we also did that through supporting patients as well who from the Jamaica Cancer Society. So how can we as the diaspora play a huge role in telehealth?
Excellent question, Ms. Lorraine Smith. We're going to go to commercial break that will give our panelists time to think about it and respond after Paulette Lewis from the UK gives her presentation. Thank you. Who's going to answer?
Find the businesses to help you live a better life, a beautiful life, a graceful life with Grace Kennedy Financial Group.
Hi, I'm Latoya Harris, Executive Director for the National Education Trust. Have you heard about us? Well, let me give you a little background on the organization. The National Education Trust is a charitable organization in Jamaica operating under the Ministry of Education and Youth. And here at NET, we mobilize financial and quality resources for schools in Jamaica to help our children. We build relationships with donors and investors to acquire resources that will improve the educational infrastructure and meet educational needs of our children. Since our inception in 2010, we have processed donations, secured grants, and assisted over 1,000 schools across the length and breadth of Jamaica. We have developed a track record for efficiency as we're passionate about enhancing the lives of our Jamaican children. We're continuing our mission to transform the schools one project at a time. You can contact us at info@net.org.jm or check us out on social media that are listed on the screen to find out how you can donate today. Let us work together to empower the future of Jamaica.
Thank you. Welcome back to our session on health and wellness, reigniting the nation for greatness, right? So we have two questions that we have not forgotten. We'll put those in the parking lot. We'll come back to those after Paulette Lewis in the UK shares with us her thoughts and her perspective on the healthcare sector. Miss Paulette, are you there?
Yes, I am here. Thank you.
Good morning.
Good evening.
Good evening.
Oh, good evening.
Good evening.
And I'm very pleased to be here. Welcome to our dignitaries and friends. I've been listening very carefully, and there's been a number of topics touched on, which I probably might just elaborate on a little bit. First, about primary care, we do know that the primary care is very important in, the healthcare system. And part of the work that we have been contributing to as a Diaspora organization in the UK was Adopt the Clinic. And we raised a vast amount of money to help with implementation of the clinics in keeping with Vision 2030. The Adopt the Clinic has many benefits in terms of its access for our clients, data collection, workforce, time spent, and all of that, which we discussed early on from Claudette. But there are still many challenges, and we need to roll out many more of these clinics across the country. So as a diaspora organization, many of the diaspora organizations in the UK, and I'm sure in other parts of the USA, Canada, and other places, would be looking at how can we actually make this happen. We have been looking as a health sector group here in the UK, working together with different organizations of supporting Jamaica, because it's very important. When we talk about digitalization, and that can improve access and quality and outcome, it can help enhance the ability to allocate, review, schedule, and plan. But one of the things we probably need to do is to use that as well to look at all the diaspora organizations. What are we contributing? how do we bring that together and collaborate? Because I think from my experience, we sometimes are doing the same thing in small pockets, where if we can come together and understand what we all are doing and bring the mass together, I think the results might even be better. So telehealth, I think is very good, because if the clinics which we visited when I was out there in those rural areas, if we have telehealth, that will help very much in terms of planning care. The doctors could be in Kingston, you could see the patients, you don't have to sit there for hours waiting for them to travel, cost would be down. So it has many, many benefits. So I'm all for that and will continue working with that. But for me as well, I think one of the very important things is about workforce and staff. So with the digitalization and the clinics and whatever we have, we need manpower. So manpower and workforce is absolutely important. So how can we use digitalization to help with manpower or workforce? We might have programs which are hybrid across UK, across Canada, because we need more lecturers, we need more education systems that we could run in parallel and learn from each other. So about 3 years ago, we did a program with UK and Jamaica around learn and return, and that was very successful. We had 13 nurses who came here. They went to Leeds, they went into the high TU, they learned for 6 months, and they got back home just in time for COVID. So the skills were really very well used. Now we have to look at more creative, innovative way, some co-productions. How are we going to develop the workforce as we expand with all the plans that we have? Because I think that's a very important aspect of delivering health wherever we are. So for me, that is really very important. But I think as we continue to support Jamaica, there are many projects, as I said before, like dementia is one, and how we see dementia in Jamaica. The cancer, right now here in UK, we're looking at how can we support cancer projects there. One of the things we do need in terms of igniting and digitalization is that I have people asking, so where and how can we access what is needed in Jamaica? So how can we do that? How can we work with health and well-being to say what is really needed? How can we support those and what difference can we make? I think there's lots we can work with what we need to know. I don't think it's easy sometimes to understand what is required. And the other point is, how do we measure success and outcomes from what we actually contribute and do? What is the outcome in terms of what we deliver as a diaspora group of support in Jamaica? So that's one. And then how we talked about encouraging health professionals to come back to work in Jamaica. So we need to stop again and think, so what can we do? And I think the learn and return is one, because I'm dealing with a number of international recruit nurses who have left our wonderful island and are working here now, who do say they would rather come back, but we need to be looking at how do we attract those nurses to come back and work in Jamaica. So that's a big piece of work I think we need to do. And I said we need to collect the information as well. Do we know how many nurses have migrated? Why have they migrated? How do we use the data to collect the data and interrogate that data and see what we can do in terms of encouraging nurses to actually return to Jamaica? So it's about working a bit smarter in a much more collaborative way. And I think that would really, really help in supporting the Vision 2030 and also improving health well-being. And one thing we're not to forget as well, which is very important, we talk very much about all the infrastructure. I don't hear much about our users of the service. And I think that's very important. Have we been doing any surveying using our users and listening to what they're saying within their communities? And how are we collecting that information to inform the decision-making we make? The patient or the client is in the center of everything we do, and therefore their voice is very important. Just as we spoke about the programs and the digitalization we're doing, if nursing staff and those people using the service are not sitting at the table, to influence how we are delivering and these services or building whatever we're doing, then we will actually finish that. And I've seen that happen. And then they take it out to use in the clinical department. It won't work. Why? We didn't have the right people sitting around the table to make it work. So I think that's really very important in listening to our users and understanding what is it they want. And again, some work we're doing here as well in the UK, using the users for long-term conditions and having hubs now where they're being taught to look after themselves. We're using clinicians to work with them. So they're now learning to look after their diabetes, their blood pressure, and things like that. So it makes it much easier. So we're educating them, educating their family, and that will also improve the outcome from health in our country and here. So those are some of the innovations. So we need to start learning and sharing the innovations across US, Canada. We hear about them when we come to conference. Now we're much more expert at IT. I'm not very good at it myself. How can we collaborate and find out what are we doing across those three areas? And how can we do much more joint up work? I think we work too much in silos and sometimes it's a repetition. So I think that's what I would say for the time being. So I'm happy to take any questions after. But one thing I must say, there has to be a sustainable program on recruitment and retention. The scale and the balance of that is going in the wrong direction. So no matter what we put in place, if we do not have the number of people and human bodies to deliver, it will not work. And therefore, that's an issue that sometimes it is sensitive and does not want to be put on the table, but it needs to be put on the table to have a discussion. Because without our valued nursing and medical staff, no matter what it is, anyone, the things that we're planning will not work. So I would very much like us to put that down as something for the future. How do we work with our partners in the United States, in Canada, and UK in terms of international recruit? What are we giving back? How can we use that? How can we learn and return or train and return, invest in nurses that are going to be servicing all those different areas? I think it's something very passionate, and I think we need to be thinking about that. Or if we have further pandemics and further issues, we won't have the nursing staff, not just for theaters, but to look after the pandemics that we have, right, to do the work. So I think I'll stop there. Thank you very much.
Lois from the UK. There are lots of questions in the audience, lots of questions online. We ended at 11:15, so I probably can't get to every one of them. That's the persons from the panel who shared their thoughts, right? So let's be fair to the persons in the room as well as those online. Let's take the first, well, there were two questions in the parking lot, right? So I think the first question that was asked was, I'm paraphrasing. Did you have it written down? It's around the investment, the investment in the adopted clinic. Have we thought about the best use of those funds that are being invested? I think that's kind of what the question is, right?
Yes, definitely. And Pastor, for you, the Adopt a Clinic, as far as the funding, it is very specific how those fundings, how the program was set up, how the funding is supposed to be used specifically. I believe it's to enhance the facility, for equipment, etc. But if it is that you are interested in some sort of an endowment, I think the foundation, Courtney Cephas is here, Mr. Cephas is here, that he would be willing to speak with you after this, to talk more about that, if that's one way you would want to go. But it's very specific how the funding is supposed to be used as far as persons who have adopted a clinic and who are interested in adopting a clinic. And as we know, CMO, I think as far as building out even the primary care, persons would know from the different facilities what the needs are. That would be in some sort of a database as far as what the needs are. And so it'd be easy to access from the persons in the diaspora who are willing to or want to provide some sort of assistance to whichever clinic it is that they've adopted. So after this, I think you can meet up with Mr. Cephas from the foundation.
Thank you so much, Minister. Okay, the second question in the parking lot was around telehealth, and specifically, I think the person referred to the use of telehealth and telepsychiatry, telecounseling, and maybe had some experience with that. So,
okay, so I think the question was, how can we in the diaspora help with telehealth? And I think two persons may have mentioned that the mentoring process, training and mentoring. You know, in terms of our training for our nurses, many of them following the training school leave shortly after, and they go to other areas. And then we have our experienced nurses that leave as well. And so within our system, the supervision and the building capacity of the nurses that remain becomes compromised. Now, our nurses go off and they gain a lot of experience and a lot of exposure. And we have not found ways in which that exposure and that knowledge can be shared. I mean, coming for missions is a specific task. You know, you come and you deal with a specific issue in terms of cases to be done. But we need to develop ways in which our nurses can continue to impart knowledge, you know, not just in terms of the actual skill sets, but also in terms of just the whole profession, what your profession is about, and the continuity of the profession in terms of these high standards, you know, because in terms of both medicine and nursing and in the paramedical areas, we find that hand-me-down that we're used to in terms of when we're trained and we're exposed to the experience and the knowledge of our mentors. A lot of that is, we've lost a lot of that because persons have left. And I think telehealth is an opportunity where we know that our nurses overseas are exposed and are using health technologies in their day-to-day practice. And I can foresee that in terms of change management, you know, if it is that we can get some of those nurses to be able to help in the training, the imparting of the knowledge, the benefits, the what's in it for me, how it is that it benefits me in my day-to-day work. You know, I think that would go a long way in helping us to transition smoothly. You know, so I think the program that we're doing, as I said, the Code Care, gives us an opportunity to reconnect. But this aspect that member of the audience has brought up, I think is a very, very practical solution that we really do need to explore. And I just also want to mention in terms of training, because the increase, I mean, the natural thing for us to do is that if it is that half of our nurses are leaving and half are staying, then that we need to increase our training so that we can cater to all markets. But the big drawback is that we don't have the trainers. And again, that is something, and Mrs. Lewis had brought this up again when we were in London in terms of, you know, the training, how it is that we can get our overseas nurses to participate using digital health technologies to impart some of that knowledge. And I think we have to work with our local persons here, you know, in terms of getting the buy-in, in terms of that training and that building capacity so that we can utilize the experience and the knowledge of our nurses overseas.
Thank you so much. It looks like...
I just want to add to that, to let Dr. Bizarre-McKenzie know that we are certainly listening. This is how we want the communication. Tell us what you want, and we're going to move with it. We have Dr. Dunn, we have Dr. Rosemary Lewis, Adamson Lewis. We have a relationship with the chief nurse, a relationship with the Nurses Association. We can enter into that. And I also want to add to basically the question that was asked about the mental health, that has already begun. Same person who asked the question has been providing virtual mental health to women with cancer, with breast cancer. And every day we get calls, persons in the diaspora have entered the United States in crisis, and the Northeast Diaspora has taken that on with Ms. Lorraine Smith.
Excellent. Let's allow Minister to...
And if I may just jump in, Ms. Powell, you had mentioned in your opening in regards to the nutrition in school, and I think you're asking how the diaspora can assist. That is something that we are embarking on. It's a continuation of the program, of course, with the nutrition in school. We are looking at front of package labeling now so the kids can understand exactly what it is that they're consuming. And we are also looking at the nutritional aspect of what the kids are eating in our schools. So it is very important, and we would love to, of course, see how the diaspora can assist with that. Because it's very important to help with our NCDs in Jamaica.
Thank you so much for responding. Okay, there are lots of questions. We're going to go to the audience. The first person I thought I saw her hands up was this young lady in the orange, and then in the yellow. Oh, okay. Please identify yourself and where you're from.
Thank you so much. My name is Claudine Reid. I'm from London, England. I'm an entrepreneur and I run a care business back in the UK. This is our 30th year. We have around 9,000 staff that we've employed over a 30-year period. I need to stand? So hearing from all of the panelists, which has been absolutely incredible, I think it was Dr. Jackie, I think I have your name correctly. So my question really is around how does the diaspora engage to better support the regulatory framework that you were referring to? That's number one. And then the second half of the question is, since I've been here, I've been doing some work with entrepreneurs. And there are some really great entrepreneurs in Jamaica, some of them based from the Branson Center in Montego Bay. Some of them have responses to some of the challenges that the country is facing right now. Is there space for that joined up thinking so that we can take a more entrepreneurial approach? So utilizing some of the entrepreneurs that are here already and perhaps utilizing the skill of the diaspora to help add value to their skills. Because when I think about the company that I run, I don't actually have nursing staff. What I have is support staff. And it's the support staff that are easing the pressure on the national health system in the UK. So we have community health ambassadors. They are championing nutrition. They are championing, I'm a cancer survivor myself. They are doing all of those things in the community so that it eases the pressure so that the nurses can really then focus on those people who are having serious issues. I know there's probably several questions in the statement, but it's more about joining up the thinking and utilizing, maybe it's the question of cross-pollination.
So anyone from the panel on live or
Okay.
probably from virtually?
All right, well, just quickly, you know, the Jamaican health system is very, very proud, and we have been pioneers in the community health worker program. From the 1960s, we have championed this. And so, you know, but the thinking in terms of that integration and of services between these para-nursing services and paramedical services, I think, you know, that some of the conversations do need to continue in an open atmosphere so that, you know, we can get the persons that are in the diaspora to share their experiences. You know, because what we change is something that, you know, takes time. And if you don't change up here, then it's difficult. And I think that the experiences, you know, for the medical profession, many of our doctors go overseas and they do fellowships and they do their postgraduate training, and then they come back. And so they are able to share and to impart knowledge. The issue is that we lose so much when we lose our nurses. And the knowledge that they have gained, we don't get the opportunity to get that back. And I think this is where the diaspora really can make an influence, because I see so many people here that are interested in doing just that. And that is one of the areas that buying into that shared service and the different roles that, different persons can play. Because we know that from looking at the future, that's how we're going to solve the problems in terms of delivering care to everybody. Because if we only depend on the specialized areas, persons that are highly trained, we will not get to everybody. And we have to utilize everybody. And we would really love to have the influence of the diaspora, the sharing of that knowledge, sharing of their experiences, to show how this has improved your service that you deliver, for that information to filter into our psyche here.
Okay, so I know there are lots of questions. We need to go to commercial break in 2 minutes. So there are two questions that are, I see you, and I haven't forgotten, to ruminate on after we come back. The questions are, what's being done now to retain the healthcare workers in the system? That's one. And the second question is, how do we engage special populations, specifically youth at risk? And the person said, I haven't heard anyone talk about seniors, young children from birth to 3, the folks who are not normally engaged with this conversation, whether they're in the dance hall or somewhere else. How to engage them as consumers of healthcare, right? But not just consumers. How to engage them to be the next generation of leaders and entrepreneur in terms of healthcare, because really healthcare is a business, right? So someone has a supply, someone has demand, and we provide services and goods. So that's kind of the question. I think I took liberty with it, but that's kind of what they're asking. How do we engage the folks who normally aren't engaged? What's being done now? What's being done to keep the healthcare workers who are leaving, the incentives, et cetera? And then special populations. Then we'll come back to this young lady in the yellow. Commercial break.
The Jamaica Business Development Corporation brings ideas to life. From concept to market, we're here to guide micro, small, and medium entrepreneurs. Nurturing talent. Developing products. Providing expert advice. Creating business solutions. How can we help you? The JBDC, supporting small businesses in Jamaica.
Want to give back to a charitable or non-profit organization? No problem. Please be informed of the following. The beneficiary must be registered with the Department of Cooperative and Friendly Societies, DCFS, and obtain a certificate of registration under the Charities Act prior to the arrival of the shipment. Shipment must be sent only in the name and address of the registered charitable organization. The nature of the shipment must be in accordance with your object and powers supplied to the DCFS. When clearing shipments for charitable organizations, the following documents are required. Copy of the Certificate of Registration, signed Special Declaration, shipping or air freight documents, example, bill of lading or airway bill, packing list, invoice, valid identification, tax registration number TRN and tax compliance certificate TCC, import permit or license if applicable, any other document deemed necessary and applicable to the shipment. Any shipment with a cost, insurance and freight C.A.F. value that is above $5,000 must be cleared by a licensed customs broker. Shipments with a C.A.F. value $5,000 and below can be cleared using the Express Clearance Process, ECP. The ECP allows the importer to authorize a shipping agent, consolidator, or freight forwarder to prepare, submit, and pay for the Simplified Declaration, IMS-4, on their behalf to Jamaica Customs. These agents can also clear the goods on behalf of the importer. Organizations registered under the Charities Act benefit from the following. For general cargo, no import duty, no general consumption tax, GCT, only 50% of applicable customs administrative fee, C.A.F, no additional stamp duty, ASD, or stamp duty. For motor vehicles, full import duty, environmental levy, and a general consumption tax will be payable. Only 50% customs administrative fee. No special consumption tax or stamp duty. For further information and updates, you may visit our website at www.jacustoms.gov.jm or follow our social media pages, Twitter at Jamaica Customs, Instagram, LinkedIn, Facebook, and YouTube channel, Jamaica Customs Agency. For questions or queries, you may email public.relations@jca.gov.jm or call 876-922-5140 to 8. Jamaica Customs, keeping our customers in focus.
Think you know Jamaica? We are agribusiness. Now you know Jamaica. Do business Jamaica.
Back to the health and wellness panel, Reigniting the Nation for Greatness, right? So I hope the folks online are still here with us. We had, I think, 2 questions before we went to break. And then we will have some questions from the audience.